Hi everyone. So we have Papa Smurf here. No, I'm kidding. This is not Papa Smurf. I like to make fun of him because of his hair. At least he has some hair to color, unlike me. But if you guys are watching this video and you have had back surgery or fusion, specifically a back fusion, you're going to want to watch this video. Okay, we've done another video of a woman from Italy who had fusion of her back, and we showed you how she can get chiropractic care. I know a lot of you are thinking out there right now, there's no way once you've had a fusion or screws put into your spine or any of that, that you can have chiropractic care. We've shown an Italian woman had amazing results with cox flexion distraction technique. He is a new patient. He came in for upper back pain, but I explained to him today that there are things that we can do since he has had surgery. I'll show you his x-rays in just a minute, but he's had a fusion from thoracic 12, T12, all the way down to L4. So 5 of his thoracolumbar vertebrae are fused, okay? And I'm gonna show you how we treat that safely, gently, with gentle chiropractic care. And we also did a woman that had a fusion, an artificial disc in her neck, and she was also able to receive chiropractic care. So there's a lot of myths and BS going on out there on the internet, and a lot of doctors doing YouTube videos yanking on the neck, and there's all sorts of stuff. But this channel here, we base it on science, and there's tons of research showing cox flexion distraction technique to be effective for post-surgical cases. So here is a x-ray of his lower back. This is not the fusion, that's the lowest back, L5S1. You could see right there the disc is really degenerative, but up higher here, we'll show you his fusion. You can see the screws there, okay? All through here, these screws, the bars on the left and the right, okay? So he's had a major fusion from T12 to L4. So what we're gonna do in this case is cold laser therapy. Cold laser therapy is really effective. Are they titanium, by the way?
Yes.
Okay, great. Go ahead and lay down on your stomach. So how often do you have to dye your beard to keep it, you know, colorful?
How long I want to keep the color, it washes out.
Oh, does it?
Yeah, every time I shampoo, it's only temporary.
Oh, it washes out, okay. You could see the large scar here under, on his back, and those of you who are watching probably can't see it. That's okay. Okay, so the beautiful part about this laser is it will detect areas of inflammation. It will also break up scar tissue. We're not going to get to that today. It's his first laser treatment. We're definitely going to focus on inflammation, muscle spasms, and pain for him. And, I mean, do you get pain every day down here in your lower back? You do. Have you probably given up doing anything for it, right?
Yeah, pretty much.
Okay. And you don't take medication?
No.
Yeah, so imagine, for those of you out there, you've had back surgery, you have constant pain, and there may be people out there that could just don't take pain medication, are afraid to, or people that are recovering addicts that don't want to go anywhere near medication. So, you can imagine it could be very difficult for some people dealing with back pain after surgery because they feel like they can't do anything else. They feel like there's nothing left. Once they have surgery, if they have pain, that's it. They have to deal with it. And that's just not the case. Cold laser therapy is really effective. It's safe and also non-addictive. Cox flexion distraction technique, also very safe and gentle, and a great option for post-surgical cases. And this laser beeped over this spot right here at L5S1. Where do you get most of your pain?
It's hard to say. It's right about here.
Right about where my laser is right now? Okay. So this laser actually finds areas of inflammation, soft tissue damage, and apparently it found the exact spot that he gets a lot of pain in, and he pointed slightly higher too. So it's usually on your left side?
Uh, I'm not. I can't remember. It's mostly.
It's all over your back?
Yeah.
Both left and right? Okay. You get a lot of stiffness in the morning, I assume?
Yep.
Okay. So the laser will help with that stiffness. In a case like, his, where he's had major surgery, you're looking at, a lot of people ask me this, how many laser treatments? You're looking at, like 3 to 5 laser treatments a week for 3 to 4 weeks, give it a break, and then maybe do another round of 15 laser sessions. So 1 to 2 rounds, and when I say a round, that means 15 laser sessions. And we're gonna scan his back all the way up here, where the rods are, where the fusion is, and found another spot. So not only does it find the areas of inflammation and soft tissue damage, but this laser also will tell me how long to dose the area. Now what I may do, I may actually have you stand up and just sort of see how it feels just after. I know it's just one laser treatment. It's not going to be, life-changing in one treatment, but I want to see if you notice a difference, okay? Before I even go into the flexion distraction technique for your back. Yeah, I do a lot of videos. Many of you have seen, I've done lots of videos on cold laser therapy. I'm a huge fan of laser therapy. It's really effective. It's a game changer. I've used it for so many injuries on myself, from partially torn Achilles to a torn labrum on my shoulder. It has gotten me through so many of those injuries much faster, at least 50% faster than I would have normally gotten through those injuries. So, I was out 7 months after tearing two partial tears in my Achilles. I was out 7 months later doing a triathlon again. And my hope here is, that we can get you back out there to do what you want to do, all right? And not be limited by your pain and your surgery, okay? So it just beeped over the other spot that he pointed to, and we're just scanning the left side of his back. We're going to do the right side next. And for those of you watching, this is not painful. This is painless. There's no pain involved with laser therapy. Okay, folks, so we're finishing up the laser for him, and we're going to just see how he feels just from one laser treatment. It's not going to be a game-changing miracle in one treatment, but I want to see how he's doing so he can also see how he feels. Go ahead, stand up for me. Yeah, let's see how that lower back is.
Big difference already, because I usually in pain getting up like that.
You are usually in pain getting up?
Yeah, getting up like that.
I don't know, just maybe bend down, touch your toe. I don't know, just...
I don't feel anything now, man.
Yeah. Looser? A lot looser. Yeah, so all we did was cold laser on his back. I'm telling you, this is a game changer. If you've ever had surgery, spine surgery or surgery anywhere, you can actually have the laser treatment done pre-surgery. You'll actually recover from the surgery much faster, and then post right after the surgery. So I've used this on myself for surgeries I've had, which thankfully are very little, very little. Okay. But I've also used this to prevent or avoid surgery on many patients as well as myself. So now we're going to go ahead and do the flexion distraction technique. So again, if you've had spinal surgery or fusion, there are things that you can do for it at a chiropractor's office, as long as he's equipped with cold laser therapy and equipped with a table like this. This table is the Cox 8 table, flexion distraction table. So we're going to go ahead and start that. Go ahead, lay on your stomach. So first, he's never had flexion distraction technique, so we want to tolerance test him, make sure there's no problems there, okay? And there are some doctors with a flexion distraction table. That doesn't mean they have the certification. So there is a difference. There really is. You need to be certified in it. The certification is an entire weekend and some testing and go over a lot of research. It's an intense weekend, trust me. It's all day for like 3 days. So we're going to go ahead and just tolerance test you. You ready? You're not going to feel much, okay?
Yep.
Do you have any pain that shoots down your legs?
No.
Okay.
Yeah.
Not yet. You shouldn't. You should not have any pain in your leg at all, okay?
No. When I was laying flat on the table, I did.
You did?
Yeah. No.
Down your leg?
Yeah.
Do you normally get numbness in your toes or in your legs?
Sometimes, yeah, when I'm laying in bed.
Okay.
Because my knee, the knees are replaced, so.
Both knees?
Mm-hmm.
So he's had 2 knee replacements and spinal fusion. And he was saying that his legs go numb. Probably not because of the knee replacements. Most likely coming from his back. And he said he had numbness. So what that tells me is his sensory nerves are compressed and irritated. And that's why he gets the numbness. We haven't checked his motor nerves, and I'm going to do that off screen. We'll check all of that. Make sure there's no motor deficit there. And this is it, right? So no pain there when I do that, right? Okay, now we're going to try this. Hold this leg. Any pain there? Any shooting pain or numbness down the leg? And here? Good. Okay, so now I'm going to strap him in. And we do this just so he can't run anywhere. No, I'm just kidding. We don't do that because if he wants to run, he can. We love people to run out of here, you know? But, yeah, this is so he doesn't get away. And for the ones that struggle, we usually use chains. It's a joke, people. It's a joke. Okay. Ready?
Yep.
You're strapped in. Now tell me if you have any pain down the leg at all. You should not.
No.
Good. Sorry about the squeaky table, folks. We just got this table reupholstered and now it squeaks. Fix one thing and another thing goes wrong with it, right? All right, how we doing there? And as you can see, it's a really gentle technique. I'm going above the rods. And now he has one vertebra that's not fused at the bottom. So what I'm going to do is actually do some flexion distraction at that very bottom vertebra. How we doing there?
Good.
And what this is doing is it's taking pressure off the disc, opening up the disc space a little bit, and also the nerve. Gapping the foramina where the nerve exits from the spine. Also called foraminal gapping. And today we're just going to go really gentle with him. And then I want to see him stand up, see how that feels. And then next week we'll get further into it. So go ahead, stand up, see how that feels. And if there's any difference from the laser to now.
I feel like I'm standing up straighter.
Yeah. Yep.
Because I'm usually like
Bent over a bit. So it's a great point that he makes there. He said he feels like he's standing up straighter. The reason for that is we're taking his spine and putting it into flexion. So normally he's already in flexion like this, but if we're able to put his spine in flexion, then his body doesn't have to go in flexion. Because in there, in the spine, we've opened up the space on the nerve. So when people feel like they're bent forward and that's comfortable for them, it's because they're taking pressure off the spine and off the nerves, right? And that's why they bend forward. It's more comfortable for them. But if I go in there and I put his spine in flexion, which is what we just did here, it's called flexion distraction technique. So by doing that, you're able to stand up straighter because your actual spine is now in flexion, but your body is standing up straight. Does that make sense?
Yeah.
Okay.
It does.
And it'll get easier and easier for you.
You just described how I walk a lot.
Yeah.
Forward like this, and I will intentionally, I'll see myself in a window and I'll intentionally straighten my back, and it hurts.
Yeah.
Where the hardware is.
Yeah, so it hurts for you to stand up straight.
Yeah,
that's going to go away.
Yeah.
Yes, that's going to go away with this technique.
Okay. Yeah.
So it's a really safe technique. If you've had a spinal fusion, just go to a qualified chiropractor that's certified in this technique. You can also go to Cox Technique, COXTECHNIC.com for a certified doc in your area. But I will say, if you don't get recertified within 2-3 years, I think he takes you off that list or something. So just call around, make sure they're certified, make sure they have the equipment, and it can be done really safely. Thanks for tuning in. If you guys have any questions or comments, you know, you can just ask Papa Smurf here, okay?
Oh, good.
All right. Thanks for tuning in, guys. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.